Extra things I would like to find out about this lady: is she pregnant or breastfeeding? Is there any pain or nerve tingling? Has she tried any medication yet? Does she take any medication, or does she have any medical conditions? Does she have any allergies or to either medication or food? And finally, I'd want to do that glass test just to make sure that the rash does disappear. So the answer to all of those questions was no, she's not pregnant, not breastfeeding, doesn't have any pain or tingling, she doesn't take any medication or have any medical conditions, no allergies, and the rash disappears when you do the glass test. So I would recommend it's most likely an allergic reaction, probably to the paint that she was using, and we could recommend some antihistamine tablets, so something like chlorphenamine tablets if drowsiness isn't a problem, and also you could recommend some Urax cream for the itching. Now we're going to move on to bites and stings. So the majority are caused by insects. Venom refers to any foreign body or protein which is injected into the body by a foreign object. Note that it is rare, but you can still get bitten by a snake in the UK, and hospitals keep anti-venom agents. And this is something that crops up, particularly when you're a hospital pharmacist, and this is something that crops up when you're on call and you have to give advice on where those products are kept in the hospital and how to give them. Some more lovely pictures for you. So the tick bite, you can see a reaction spreading out from where the tick has bitten, and with a bee sting there will be a defining mark where the sting is, and then you'll get swelling out from around the area. Our presenting features or symptoms: so with bites you get itching, papules, wheals and pain. Stings, you'll get a more intense burning pain, redness, edema, because there's more of a systemic response. Referral criteria: so if the swelling is really intense, or there's any bleeding, or you think there's any restriction to blood flow, and those red flag symptoms, if there's any flu-like symptoms with the bite, so things like temperature and malaise, you can get Lyme's disease from tick bites, so that's important, that's referred. If there's any signs of anaphylaxis, so difficulty in breathing, swelling of lips, then you can actually administer an EpiPen there in your community pharmacy. Treatment: we can give paracetamol or analgesics for any pain. For any itching, we can use a antihistamine, either a tablet or a cream. And if there's any swelling or erythema, then we can also use a topical corticosteroid. Those practical tips that we can give: if a parent arrives in your community pharmacy and their child has just been stung, say, by a bee, then they can be quite panicked, as anaphylaxis is quite common with bee stings. So at the same time as trying to reassure them and calm them down, you need to be able to deal with the child, obviously, and assess the situation and recommend any appropriate treatment. Meningitis is a very serious infection. There are two types. It can be either bacterial or viral, and anyone can get it at any age. If you suspect any symptoms or observe any symptoms with that could indicate bacterial meningitis, then you need to urgently referral, and the patient needs to go to A&E as soon as possible. Those presenting features or symptoms: a very high fever, they might be quite agitated or drowsy, photophobia or dislike to bright lights, and there may be a stiff neck. So you can ask somebody to see if they can place their chin onto their chest, and if that poses a problem, that can indicate a stiff neck. For children, it's a bit more difficult, but you can look out for things like cold hands and feet. Are they vomiting? Are they refusing to feed? They might be agitated and constantly want to be picked up. drowsy, floppy, or unresponsive. So we mentioned the long non-blanching rash earlier on. So if rash appears, then all rashes really you should do this test on to make sure that it's non-blanching. If it is non-blanching, this could be an indication of meningitis and urgent referral is required. How do we treat? Urgent referral to A&E. So things can deteriorate quite quickly and many people die from this infection. It's likely that they're going to need high dose antibiotics or antivirals, so the quicker they get to hospital, the better. Melanoma is a cancer that can begin on the skin, and the cells in the skin begin to develop abnormally. Those things that can increase your risk of developing melanoma: pale skin that burns easily, people with red or blonde hair, or have lots of moles or freckles, a family history with somebody who's had melanoma, those who have a condition that suppresses the immune system, such as HIV, or those that are on medication that suppresses their immune system. So we talked a bit about that earlier. So this could be somebody who's on medication after an organ transplant or chemotherapy. They can appear anywhere on the body. They can even develop under the nails, but the most common places are the back, legs, arms and face. Presenting features are a mole which either can get bigger, it might change in shape or colour, it might be itchy or painful, or become crusty or bleeding. This is a useful tool to help you identify melanomas. Are they asymmetrical? So they have very different halves and have an irregular shape. Is there a border? Is it a notched or ragged edge? And often they're not smooth. What colour? Is there a mix of colours? Has there been a change in colour of the moles? Normally, melanomas are greater than 6 millimetres in diameter, and if there's been any change in size or elevation of a mole, this is an indication that it could be a melanoma. These are some images just to give you a clearer idea, but you can see the ragged edges there and the different colours within the moles, and on your questioning you can ask during your WAM questioning whether there has been any enlargement or any change in the moles. Treatment: go to see the GP. Our final skin condition for this lecture is cellulitis, and that's an infection of the deep layers of the skin, which can cause the skin to be red and painful, swollen and hot. It can occur anywhere on the body, but it's most common on the legs. It can develop when a bacteria or fungus moves through the skin surface through damaged or broken skin. So skin conditions that cause breaks or cracks in the skin, these patients are more vulnerable and at higher risk of developing cellulitis. It can also occur after having a cut or burn or bite. Those common presenting features are high temperature of 38 degrees or above, and because it's quite a serious infection, there can be confusion, a rapid heartbeat or rapid breathing. And just under my picture there, it also says dizziness. So if somebody is getting dizzy when moving, say from lying to sitting or sitting to standing. These are some images to show you some examples of cellulitis. So as you can see, the skin is very red, it's swollen, and you can imagine that it would be hot to touch. What is the treatment? It's direct referral. So depending on how severe it is, you can recommend that they go and see their GP today, or if it's really bad, then really they should go to A&E because they'll need high dose intravenous antibiotics. So hopefully now you should be able to list those common skin disorders that are commonly coming you might see in the community pharmacy. Looking at the symptoms, be able to differentiate between the two. I know with skin conditions that's very difficult because a lot of them are similar. Be able to diagnose different conditions and give advice on appropriate management with over-the-counter medication, non-pharmacological interventions, and also know those warning signs and when it's best to refer. If you have any questions, then please don't hesitate to email me. I'm going to put one more task onto Blackboard for you to do, where I'm going to give you different images of different skin conditions to see if you can identify which they are.